We are not a zoo. We are not animals to be watched. We want to be a part of it. This is a quote from one refugee female. I want to talk to you a little bit about my research, what I've done in the past, what I'm currently doing, and what I plan to do in the future. My name is Staci Smith, and I am excited to talk with you today about my research. First of all, let me give you a little bit of background about myself. I have a PhD and a master's in strategic communication from Purdue University. Prior to that, I have a degree in elementary and special education. I actually taught in an autistic unit. I am a Fulbright scholar. I did my Fulbright in Slovenia, and I'm also a two-time Page Legacy Scholar. I am co-editor and author of a book called Methods for the Marginalized. It's coming out soon. I'm really excited. I'll talk about that a little bit in my presentation. So let me talk about my research agenda. So I'm at the intersection of strategic communication, crisis coping, and marginalized populations. So when I first started my Fulbright, started doing research with female professionals. And then I started thinking there were all these refugee females, and I really wanted to also include them as part of my research. So when I was on my Fulbright, I applied for a Page grant to do research with some refugee centers that I had volunteered at previously as part of study abroad with some students that I had taken. And so I did my Fulbright with female professionals, but also with refugees. I'll talk a little bit more about that as I move forward. But the intersection, I also talk about CSA and refugees, and that is how the book, Methods for the Marginalized, I started to get in these spaces where I was doing research with marginalized populations, and I thought, wow, there are a lot of things that we are not talking about. And so I reached out to the Page Center and said, I know you just gave me a grant for refugees, and thank you, but we need to start talking about how do we do research with marginalized populations. This is not the same type of research that I had done previously. And they agreed, and they gave me a $30,000 grant to co-edit the book and also be an author in it, and to bring in other individuals in the field who are also doing work with marginalized populations. And I will talk about that a little bit more later, but I'm really excited. It has been something that I have loved being a part of, and something that I know is going to have a big impact in the field. I also, with marginalized populations, while I was there on my Fulbright, I went to NATO and did a training for them. And while we were there, we decided to collaborate to do some research that they needed help with misinformation and influencers. And again, I reached out to the Page Center and said, hey, I really want to do this research with NATO, but they only have so much funding for the year. And would you be willing to sponsor the research? And I received a 10,000 grant for them to do the research with NATO. I also look at the adoption of health-seeking apps. I did this during COVID, and what information we're willing to share with different communities that we're a part of. All right, so I'm a mixed methods. I look at computational methods, semantic network analysis, big data sets on Facebook and Twitter, but I also like qualitative research and looking at focus groups and interviews and Q-sort. So the pro-social mandate, stakeholders, and this is starting to start talking about my research with refugees. So stakeholders have expectations that companies are going to get involved in social issues in their communities. So let me talk about what corporate social advocacy is. Communication in which an organization or organizational rep either intentionally or unintentionally takes a stance on an issue unrelated to business interests, usually a social political issue. So, corporate social advocacy can be really risky because a lot of times companies will start getting involved in something that they're either unfamiliar with or something controversial, like the refugee crisis. Oftentimes it can alienate their stakeholders or make them boycott. So, when I started my Fulbright, I thought, you know what? I'm at a point in my career and with my research that I really want to do research that has impact. I just didn't want to just do another research study, but I really wanted to do something that meant something to me, and also that had impact in the field and just an impact in communities and globally. So enter the refugee crisis. Like I said, prior to the decision that I wanted to go in and do this research with the refugees, 2 years prior to that, I had taken students on study abroad, one time to Spain and one time to Italy. And both times I had the students and myself, I thought, you know what, we're going into these countries and we're doing a lot of things, a lot of exciting and fun things, but I really wanted us to give back. I didn't want us to just come and do something. I wanted us to leave the countries that we visited, with having an impact, with doing something. And so we started to volunteer in these refugee centers, and I started to notice some things. Some of them only had men, and some of them had women in them, but a lot of times, they were separated. And I thought, you know what? There's something here, and I want to document and come and talk with these women about how they are coping with their life, with their new country, with their new situation. So the refugee experience, just a little bit of background on this. There are 110 million displaced individuals. And when we're starting to talk about the refugee crisis, I use the refugee word only as a description. Um, a lot of times it has a lot of negative connotation with it. But when I went to go get the grant and when I had to do IRB approval, there are lots of individuals who come to these centers across Europe and in the United States. And I had to narrow this down. And so it had to be individuals who were either had refugee status or seeking refugee status. There's lots of other things like asylum seekers and all sorts of different reasons why people would come to get help. But for the purpose of this research, when I'm talking about it, I will use the word refugee. Um, but in no way are these individuals refugees to me. They are women who have life, who have experiences, who have families, who are to me not refugees, but are fellow women. But for the point of this presentation and for research, I will refer to them as refugees. All right. So one of the things that I found when I was in some of these centers, oftentimes they would have women's only nights or time when there would be no men allowed, which was great, which was fine. But a lot of times, in fact, the research states 8 to 1, men's stories were being documented more than women's. And to me, that was sad because the refugee crisis is not just about men, and it's really not about women, just about women. It's about both. It's about families. But these women's stories were getting lost, and the men's stories were getting documented. And so I decided that I wanted to go in to refugee centers that I had worked with previously. One of the reasons is you don't just show up to a refugee center and say, I want to do research. It doesn't really work that way because they have a lot of people who want to come in and do research. And like my quote in the beginning, we are not a zoo. We are not animals to be watched. We want to be a part of it. A lot of the centers have a lot of individuals who want to just come in and do research with the refugees and be done. And one of the things I said to all of the centers, I will come and volunteer and be a part of this. In fact, we volunteered for 6 months teaching English, and I didn't receive one interview during that time. And so I wanted them to know that regardless of whether or not I received any interviews, that I wanted to come and be a part of this. And so I picked fruit, I cleaned floors, I sat next to women, I organized dog food. I did so many different types of service. One, I wanted to be a part of the solution and not just one that comes in one and done. And so I had had this 2 years prior experience with a lot of these refugee centers. So they knew me, they knew my face, they knew who I was. And so when I came back and said, I really want to document these women's stories and I want to know how they are coping and how they are being resilient in this really difficult situation. And I was really surprised at some of the results that came out of this. Uh, all right. So here I'm just talking a little bit about the method. So I interviewed refugees. I interviewed refugee females, but I also interviewed those who worked at the centers. So those who volunteered at the centers and those who also run the centers. I wanted a holistic approach to what is actually going on and what are some ways that we can help with this situation. What are ways that we can help them cope? What are some things that we can do? And so it wasn't just the refugee perspective, although that was something I really wanted to focus on. But I also wanted to focus on how the centers were helping or not helping these refugees. And so I interviewed at across Europe. I interviewed in Italy, Austria, and Slovenia. That was the first year. And then I went back and interviewed the second year and added some to that. Uh, but I wanted to just know what was going on, and also the United States. I did some interviews with the United States as well. Those were a little bit different. They didn't really have centers that they were going into to get resources from. So it was a little bit of a different situation in the United States as opposed to how it was in Europe. But let me talk a little bit about some of the things that I found. So the refugee crisis, right? It's not going away. This is not something that is just going to have a solution and it's going to be done. And there's it's ongoing. This is going to be a long term um, situation that is going to need a lot of individuals to help the centers to work and also to help the refugees to cope. So let me talk a little bit about some of the challenges that they have. They have some logistical challenges. So a lot of times when when they one of the quotes that one of the females said to me is, when they hear we are refugees, they don't want to rent to us. They had a lot of logistical issues with housing, with food, with finding foods that they were familiar with, putting their kids into school. There's another quote. Another female said some organizations give a lot of help for Palestinian families, but Syrian families no. A lot of the centers, so some of the centers were really good, and some of them were not. Some were really struggling, and it really showed up in the interviews. And some of the centers said that it was really difficult because individuals will come to donate items, would say, I only want this to be used for a certain type of refugee. And then they would have someone come in who had that need, needed a bike or they would often donate furniture, and they didn't have the freedom they could to give them the needs. But the refugees really felt that. They really felt that there were a lot of logistical issues sometimes that they had to get over. Oftentimes, it would also be language. In some countries, they would have to take an exam, and they would have to take an exam each year. And when they got to year 3, if they didn't pass the exam at a particular level, then they would have to leave. That's really tricky after they've already got their family into schools, they've already got their housing, they've really worked hard to get into the social and cultural that was happening in that country, but they couldn't they couldn't stay because of a language to exam. So some of the cultural and social things that they had: we are not a zoo. We are not animals to be watched. We want to be a part of it. They do not want to be on the outside. They want to be in it. They want to be included. They said it's not easy to get friends. When you come here, you meet people, of course, but you say you need a close friend. That's really hard to find. Familiar education, I said, if I can't pass the language exam, then they cancel me. And a lot of these women hadn't had the opportunity prior, when they were in their home country. They didn't have the opportunity to receive education. And so they didn't have that training that they needed in order to learn language. They say we try to create home with our small family. We try to do some games and to forget about what we face outside. We teach our children more about our religion and how to be peaceful and how to forget and forgive, even when other people hurt us. All right. Uh, so some of the challenges that they had, I think I've already talked about that one, and this one as well. It really came up a lot across all the centers. They want to be included in the communities. They do not want to feel that they are on the outside. Now, I want to talk a little bit about the NGO side, about the volunteer side. It can get really complicated because you've got volunteers coming in. You also have companies who want to donate things. You have individuals who might come with their own, like volunteers who might come with their own mental health issues or their own agendas who are showing up. And it can be a lot for them to manage. And so I want to talk a little bit about this. A lot of the centers, and like I said, it was so varying across it, and I could go into lots of detail, but I want to give just a brief overview of this. Even on on the NGO side, they would say, we don't want them to feel like they're at a zoo, right? We want the refugees to have new relations so they can come out of their local community. We talk about integration. They would talk about autonomy. I don't think this is a place for me to decide who needs something and who doesn't. Who am I to say that, right? They really are really striving to humanizing the refugee rather than just feeling like they're a number that comes in and that they, want to just give everyone the same thing. They really try to focus on the individual. Volunteer engagement was an issue. They said we have a lot of volunteers that come once and then they don't want to come back again because it's a lot of work and it is really exhausting. Some come with hidden agendas and even hidden mental illnesses. It's not efficient. Sometimes nobody knows how much is done by volunteers. They don't. It's just very difficult to work with. So one of the other challenges that NGOs would have is corporate involvement. Companies don't really want to understand because normally they don't do things with refugees. So a lot of times companies would want to come in and they would want to help. For example, in one of the countries that I interviewed, one of the volunteers said, "You know what? This company wanted to come in and they wanted to donate some office furniture, and they wanted to put hats on and have pictures of the refugees, and they didn't want to do that, and they didn't really understand. Yes, it was great that they wanted to donate the office furniture, but to require then that they would get images and pictures of the refugees was almost taken a little bit too far, right? And so companies really don't understand. They don't deal with refugees on a daily basis. And so it would be difficult for the NGOs to know how to deal with companies. And sometimes companies would donate stuff and say, we don't want you to say anything about it. And other times they would want them to say something about it. And so it can cause a lot of work and a lot of times just a difficult space to navigate. And this is one of the quotes that one of the volunteers had said: "It's not about the company, it's about the people that need their help. So we educate them a lot with what we do when it comes to refugees because they really don't know." And a lot of times, they want to come in and just do a one and done day, which is fine. Sometimes that works great. But really, what the refugees need and what the companies have to offer really has to be coordinated with the NGOs and with the volunteers. So volunteers, this is one of the things I talked about, also can be an added problem. A lot of times I would see some of the volunteers, in fact, in one of the centers, it was really sad. Some of the volunteers added so much to the problem, so much to the situation for the refugees, that one of the women had her children taken from her. Now, one of the issues that we found a lot was what is considered domestic violence in their home country and then the new country that they were in was not the same. And a lot of the volunteers would exasperate this issue rather than help them and educate them. They wanted to, immediately involve the law and immediately involve the police, and it tore families apart. And so you would see these women really struggling because although they had not been the one to um, to be a part of the domestic violence, because they were in the home and culturally where they had been before, that was an okay thing to have happen. But in their new country, it was not. And they really felt torn. And it was really sad to watch and to listen to their stories on this. Um, One of the NGOs had a really great way of looking at this. It's called the Sandwich Apple Bottled Water Strategy. And this was actually one of my favorite centers. I have been back to it several times and I have seen it evolve over the years, and they are doing a great job. But one of the things that she talks about is that we do not have this idea that everyone needs a sandwich, everyone needs an apple, everyone needs a bottle of water. No, sometimes someone comes in and they need a bowl of soup. Someone comes in and they might need clothes. Someone else comes in and they might just need someone to listen to them. That you don't give everyone the same thing. Not everyone wants a sandwich, apple, and a bottle of water. They might want a cookie, right? There's just so many different things that they need and needs that they have, and that you need to treat them like they're human rather than just trying to just give everyone the same thing and think that that's what everyone needs. And I really, really enjoyed interviewing that center and working with that center. And the refugees there, you could really tell a difference in their stories and their experience that they had acclimated to the country. So I want to talk about this overall. Like I said, I could talk about each of the individual countries and each of the individual centers. But the overall thing that I really want to talk about is what is the CSA imperative and impact? So there's like a difference between the practice and what is actually really needed. So in practice, what's happening is a lot of companies are coming in and wanting to do a one and done. A lot of volunteers are wanting to come in and do a one and done. A lot of times they want to give something for a contribution. It might be money. It might be product, it might be time, it could be all sorts of things. And a lot of times they want publicity, right? They want it to be in the newspapers. There were some times when they didn't want to, right? Because in some of the countries it's really controversial, the refugees. And although they wanted to help, sometimes they didn't want their name. But a lot of times they did, they wanted the publicity. But really, what really needs to have happen is the NGOs really need, and the volunteers really need to help the refugees to cope, really need to help them to acclimate to their new place with, well, it's going to be their new home and most likely their permanent home, their new home. And how can they cope? And what are the laws and what are the expectations that they have there? That also needs to be a partnership. It needs to be ongoing. It needs to be something where, you're going to come in and help, but you're going to also not just help in the way that you want, but in the way that we need here at the center. One of the centers had individuals who would come in and uh, they wanted to practice. They were students were psychology students, and they wanted to practice on the refugees. And a lot of them said, "No way! I do not want you practicing on me or my children. I really want someone who is trained." And the other centers would say, "You cannot come in here unless you are trained." And so there was an interesting thing with that, right? It really needs to be a partnership, and it really needs to be people who are professionally trained and who aren't showing up, with a lot of their own issues, making the issue more complex. It really is about engagement and helping them so that it is a humanizing experience. There also needs to be a lot of listening to the needs of the refugees, listening to the needs of the center, listening to what the company wants to do. There's a lot of that really needs to go on. So although these things are going on in practice, right, that's one of the things I found with my research, but really what we need to have is we need to have this coping, this partnership, this engagement and listening. And so how do we do this? So I suggested the cycle of issue impact, the effects, sorry, crisis affected publics, the cycle of issue impact. And there's some things that need to happen. First of all, it's a cycle, so it kind of keeps going around and around, but there needs to be active listening and actually listening and hearing what the needs are and what are the things that need to be done, or what is it that we need to do between these different partnerships. There needs to be this engaging the relevant others. So engaging, if it needs to be professional psychologists, engaging individuals, companies who might have excess of resources or products that they could give, or engaging individuals who could help with housing. Housing was such a big deal for these refugees, and engaging those relevant others. Who do you need to have that's in the community? The volunteers that you need to have, the companies that you need to have, and engaging them in that. And then, partnering for advocacy, advocating that they are not a zoo, that they are not on the outside, that they need to be included in the community. They need to have friends. They need to be included in the events that are happening. They need to have that sense of we are a part of this. And then facilitating coping, helping them to develop strategies. And some things that might have been okay in their home country are not going to be okay in their new country, and helping them to cope with that, and not just coming in and saying, this is the law and this is how you need to do it, but helping them to cope and helping them to transition to that. And again, more active listening, and again, engaging. And it just is a cycle of issue impact so that we can help these crisis effective publics so that they can acclimate into their new communities, so they can acclimate, and in this case, refugees, so that they can be a part of it, and so that this situation, which is now going to be their situation moving forward, can be a good and positive one for them. Again, I could talk about this for hours, and it really has meant a lot to me. I really want to do research that has impact. It's the main reason why I started to do research with the refugees. It's the reason why I have the book Methods for the Marginalized that talks about all sorts of different type of individuals who are marginalized and how to do effective research with them, how to protect the researcher and also those who are researching, and how we need to do that in a professional way. And like I said, I'm just so excited about this research and that it's had an impact. That's really what I'm looking for in the future when I go to do research. Is I want this to have a positive impact, either locally at a community, but also globally. And this next year, I'll be continuing my research with NATO. I will be going back this summer and doing a training with them to follow up on the research that we did with influencers and how we can handle that misinformation and disinformation. So continuing my research with marginalized populations with NATO. And also, I have been invited to come back. Fulbright, usually it takes 5 to 7 years to come back. But the Slovenian embassy and Fulbright have asked if I would come back on a grant this summer to continue some of the research with the refugees. I feel really honored that I'll be able to continue this research with those women, and to be able to continue to document and to continue to be a part of this. As you can tell, I'm a little bit emotional when I talk about it, because it really did change me and it really did have an impact on me. But I'm also hopeful that it will have an impact for these women, for these refugee females, and for their life that they're in now, and for what is going to happen with them in the future. I hope you enjoyed listening to my research. I'm happy to answer any questions that you would have. Here's my contact information, or if you'd like to collaborate. I'm always looking for individuals to be a part of my research and to work together. Thank you.